Hey there. Today, we're diving into something that millions of people deal with every single day, but it's often kind of confusing and super frustrating. We're talking about irritable bowel syndrome.
Let me ask you, does this sound familiar? You're just trying to live your life, but you're constantly getting knocked off track by stomach pain, that awful bloating, or that sudden urgent feeling that you need to find a bathroom like right now. It can totally wreck your day and make you feel like you have zero control.
Well, if any of that is ringing a bell, I really want you to hear this. You are so not alone. What you're experiencing are the classic signs of a really common condition called irritable bowel syndrome, or what most people just call IBS. So that's what we're going to do right now. We're going to give you a clear, no-nonsense look at IBS based on what the experts know today. We'll break down what it is, what you can expect if you're trying to get a diagnosis, and this is the most important part, all the different things you can do to start feeling better.
Okay, so first things first, let's get a really clear definition. What on earth is irritable bowel syndrome anyway?
When you boil it all down, IBS is basically a mix of two main things. You've got that pain in your abdomen, and you've got changes in your bathroom habits. The official definition says that to have IBS, you're dealing with that pain at least one day a week, and it's directly tied to what's happening with your bowel movements. And, doctors have a pretty specific checklist to figure this out. That stomach pain has to connect with at least two of these three things. One, it's related to actually going to the bathroom. Two, there's a change in how frequently you're going. And three, there's a change in what your stool actually looks like, its consistency. Now this right here, this is a really big deal. While the symptoms of IBS feel awful and can totally disrupt your life, it's so important to know that IBS is what's called a benign condition. That's a medical way of saying it doesn't physically damage your intestines, and it absolutely does not lead to other serious diseases like cancer. Just hearing that can be a huge relief. Now, you might think IBS is just one thing, but it's not that simple. It's actually broken down into different types. And this is super important because figuring out your type is what helps your doctor tailor a treatment plan just for you. So, how do they do that? Well, doctors classify the types based on stool consistency, and they often use a handy tool called the Bristol stool chart. It's pretty simple. On one end of the scale, you have types 1 and 2, which are hard and lumpy. On the other end, you've got types 6 and 7, which are loose and watery. And that chart helps us define the main subtypes. So if more than a quarter of your bathroom trips end up in those hard categories, that's called IBS with constipation, or IBS-C. If more than a quarter of them are on the loose end, that's IBS with diarrhea, or IBS-D. And yeah, for some people, it's a mix of both. We call that IBS mixed. Knowing which one you are is step one to getting the right help. Okay, so you've got the symptoms, you know about the types, but how does a doctor actually say, yep, you have IBS? Let's walk through that whole process. Here's the key thing to understand. There's no single blood test or scan that just screams IBS. Instead, it's what's called a diagnosis of exclusion. That just means your doctor's main job is to play detective and first make absolutely sure your symptoms aren't being caused by something else. So what does that detective work look like? Well, your doctor will ask you about any red flag symptoms, stuff like losing weight without trying or seeing blood. Then they'll probably run a few tests. This could be some blood work to check for things like celiac disease, maybe a stool test to make sure there's no infection, and sometimes a colonoscopy to get a good look inside. This is all just standard procedure to make sure they get the diagnosis right. So, once all those other conditions are ruled out and you officially have an IBS diagnosis, the focus shifts. Now, it's all about creating a treatment plan that is personalized just for you to help you manage your symptoms. Treating IBS isn't about finding one magic bullet. It's more like building a house. The foundation for everyone is education, reassurance, and making some changes to diet and lifestyle. If that's not quite enough, the next level might be adding in things like medications or psychological support. And for the most severe cases, you might bring in a whole team of specialists. The goal is just to find the right level of support that you need. But before we get into any specific treatments, I have to show you this. It's so important. Research has shown pretty clearly that one of the biggest predictors of feeling better is having a strong, trusting relationship with your doctor. Seriously, feeling heard and working like a team, it's a massive part of managing IBS successfully. Okay, so let's talk about that foundation. For a lot of people, making some adjustments to diet and lifestyle can bring some pretty amazing relief. we've all been told to eat more fiber, right? But with IBS, it's a little more complicated. The type of fiber you eat makes all the difference. Soluble fiber, think psyllium, dissolves in water and creates this gel-like substance. It's usually way easier on the gut and can actually help with both constipation and diarrhea. But insoluble fiber, like what's in wheat bran, doesn't dissolve. And for some people with IBS, it can make bloating and pain even worse. And beyond fiber, a few other things can really move the needle. Regular gentle exercise is great for gut motility and stress. Certain probiotics can also be a big help. The research is best for a specific strain called Bifidobacterium infantis. And then there's the low FODMAP diet, which helps a lot of people. FODMAPs are just these types of sugars that can be tough to digest. This diet is definitely something you want to try with help from a dietitian or doctor, though. All right, so what if you've done all that stuff? The diet, the lifestyle changes, but it's just not enough. Well, that's when your doctor might start talking about the next level of treatment.
And this is exactly where knowing your IBS type, IBS-C or IBS-D, becomes so crucial. Because the medications are chosen specifically to target your main symptom. If abdominal pain is your biggest problem, they might try things like antispasmodics or peppermint oil. For IBS-D, there are meds to help slow your system down. And for IBS-C, there are options to help get things moving. See, it's a very personalized game plan.
And this is such an important mindset shift. The goal here isn't to find a cure that makes IBS vanish forever. The real goal is empowerment. It's all about finding the right toolkit of strategies that works for you, so you can manage your symptoms and get back to living your life without fear or frustration. Wow, we have covered a ton of ground. What IBS is, how you get diagnosed, and all the different ways to treat it. So, after all that, what's the most important thing you can do? Where do you even start? It all comes back to this one thing, partnering with your doctor. IBS is complicated. What works for your friend might not work for you. This whole journey is about teamwork, trying different things and finding the unique combination that helps you feel good. You absolutely do not have to do this alone.